Well, when I was in medical school, they have you go through all the specialties, and I loved every one I went into. But when I went into OB, there was something that just resonated with me. Being there with women during the miracle of birth, I mean, very private, very privileged, intimate setting, but then also following them through from adolescence to end of life issues. And I thought that was, you formed a real connection, and I really enjoyed being able to follow women through all those phases of life. So a lot of it is getting to know them, knowing what their background is a little bit. It's good to know about not just their vital signs and everything comes onto the chart, but who these people are and what their expectations are. And you really get to know a lot about people, and you can help them much better if you know where they're coming from. And so it's fun to inform them and educate them on all the different levels of what they're going to expect through getting pregnant, during the pregnancy, and post-care. And it really forms a great bond. I mean, we see these women at church, in the grocery store, in the restaurant. My kids are always like, oh my gosh, Mom, we have to stop again. And it's a wonderful feeling. It's great for them to recognize us. It's great for us to see the babies and the kids as they grow up. It's a privilege. I think of all the things that make the biggest difference in people's health is that they are engaged in their health care and they show up. I mean, half of it's just showing up. So I know a lot of people are scared of, the mammogram, or I'm scared to get blood work done, but showing up and letting us evaluate them, a lot of times it decreases that anxiety. So being engaged, just like life, you gotta show up. Well, my time is really busy with the kids and taking care. So I love being a mom and a wife, and I love, because we live in the coast, I really love being outside and taking advantage of all the things, paddleboarding, biking, and enjoying a lot of the parks that we have here in town. And then I am very strong family-based, so I do a lot with my family. I think most people that get to know me find that I am really invested in them. And that's not something you know when you meet somebody. You may say, oh, that was a nice interaction with a physician, but I am invested in their health care, and I'm invested in my job. I'm invested in my family, but I'm equally invested in my career and their health. And I think that's important to have a physician that feels that way about their patients.